Sleep is a vital and necessary part of your daily routine. Quality sleep is as essential as fulfilling needs of hunger and thirst. In this video, we will cover the consequences of sleep deprivation. Sleep deprivation has real-world consequences. Consider the Exxon Valdez oil spill, Chernobyl nuclear meltdown, 3 Mile Island accident, Challenger explosion, Bhopal disaster, and Gulf War friendly fire casualties. Maintaining healthy sleep levels is essential to keep yourself, peers, and patients safe. In 2002, 149 residents at 5 U.S. academic health centers from 6 different specialties were recruited to participate in a residency fatigue study. The residents were administered the Epworth Sleepiness Scale, known as ESS, is a self-administered questionnaire with 8 questions. Individuals are asked to rate on a 4-point scale from 0 to 3 their usual chances of dozing off or falling asleep while engaged in 8 different activities. Most people engage in these activities at least occasionally, although not necessarily every day. The higher the ESS score, the higher that person's average sleep predisposition in daily life, also known as their daytime sleepiness. Based on ESS results in this study, 84% of residents scored in the range for which clinical intervention was indicated. Sleepiness was equivalent to that found in patients with serious sleep disorders. As shown in the figure, medical residents have a higher ESS score than those with sleep apnea and just less than in individuals with narcolepsy. Physician fatigue is caused by a myriad of factors. Insufficient sleep due to on-call sleep loss and inadequate recovery sleep, fragmented sleep as a result of pages and regular phone calls, circadian rhythm disruption caused by night float and rotating shifts, and primary sleep disorders, including sleep apnea, among others. There are many possible consequences of a sleep-deprived resident. Happiness in the workplace is negatively impacted. Mood and performance can suffer. The quality of patient care and professionalism is reduced. The ability to learn and absorb new material diminishes. Family relationships can be adversely affected. And personal health and well-being are often ignored, leading to burnout. Finally, driving safely is more difficult. As shown in the figure, the Army did an interesting study many years ago looking at Army recruits and the effects of sleep deprivation on basic math skills. As you can see, the effects of 72 hours of sleep deprivation resulted in a significantly decreased proficiency in recruits completing basic math tests linearly over the 72-hour period. In medical residence, the highest risk time period is between 6 a.m. and 10 a.m. During this time, sleepiness levels are much higher, cognitive errors are much more likely, reaction times slow down, and attention lapses increase. For decades, many studies have suggested a direct link between fatigue and decreased performance, resulting in compromised patient safety. Here are some studies to consider. In surgery, an inadequate sleep resulted in 20% more errors and 14% more time required to perform simulated laparoscopy skills post-call. In an internal medicine study, sleep-deprived interns were found to have decreased efficiency and accuracy interpreting EKGs. And finally, sleep-deprived pediatric interns needed more time to place an intra-arterial line when sleep-deprived as compared to their controls. Additional studies done by Gravenstein found that more than 60% of anesthesiologists surveyed reported making fatigue-related errors. This is but one of numerous case reviews that have linked medical errors to fatigue. Studies have shown that 3% of anesthesia incidents, 5% of preventable incidents across the institutions, and 10% of drug errors are in some part fatigue-related. Haynes et al. Found an increase in post-operative surgical complications to be as high as 40% higher if the resident was post-call. Fatigue not only poses safety concerns for patients, but for doctors and trainees as well. 58% of emergency medicine residents reported near-crash driving. 80% of these incidents were post-night shift, and they increased with the number of night shifts incurred per month. Parks et al. Found a 50% greater risk of bloodborne pathogen exposure incidents in residents between 10 p.m. and 6 o'clock in the morning. Driving while drowsy is a significant concern. Sleep deprivation impacts your ability to drive safely. In a study surveying 1 year of events with shift workers in a hospital, 13% were involved in a motor vehicle accident and 37% experienced a near accident due to sleepiness. A survey of residents during a 3-year residency found that 44% had fallen asleep at a red light and 23% fell asleep while driving. As shown in the figure, the greatest number of car crashes typically occur at 2 times of the day, during the nighttime period of increased sleepiness and the mid-afternoon. The curve mimics studies measuring sleep-deprived task performance, i.e., the worst performance between 6 and 9 a.m. and at 3 p.m. in the afternoon. It is important to be able to identify the signs of driving drowsy. These include trouble focusing on the road, difficulty keeping your eyes open, nodding, yawning repeatedly, drifting from your lane and missing signs or exits, not remembering driving the last few miles, and closing your eyes at stoplights. We do know that there are ineffective strategies for driving safely while drowsy. These include turning up the radio, opening the car window, chewing gum, putting cold air or water on your face, slapping or pinching yourself, and promising yourself a reward for staying awake. Remember, it takes only a 4-second lapse in attention to have a drowsy driving crash. The best way to prevent fatigue-related motor vehicle accidents is to avoid driving if drowsy. If you are really sleepy, get a ride home, take a taxi or Uber, or use public transportation. Take a 20-minute nap and or drink a cup of coffee before going home post-call. Stop driving immediately if you notice the warning signs of sleepiness and pull off the road at a safe place where you can take a nap. Remember, GME reimburses residents and fellows for taxi or Uber that is taken post-call to drive home safely, and will reimburse the cost of your return trip to the hospital. Thank you for watching part 2 of this video series. In part 3, we will cover recognizing sleepiness in yourself and in others.